You're listening to the Health and Happiness Podcast with Travis Kemper and
Lauren Maxwell. Each episode, we share easy to implement strategies to improve your health, happiness, and overall quality of life.
I have always believed that the primary function of doctors should be to teach people how not to get sick in the first place. The word doctor comes from the Latin word for teacher. Andrew Weil. How's it going, Travis?
It's going well. It's getting cold. I'm loving it. I started my new schedule at work, and it's so much nicer. I can actually do stuff like on the weekdays, and like get things done during the week that need to be done during the week. Like I registered my truck.
Nice.
Yeah, it was great. And without doing those things over lunch because it's stressful to try and. I'm sure every single person. Yeah, I'm sure every single person can relate to that one. It stinks when you have to like waste your lunch going to do something because everything takes longer than you think it's going to take.
Yep.
Yeah. So schedule's much better. How's it going, Lauren?
Yay. Well, I'm glad your schedule is working well for you.
Thank you.
It's going good. We've had a really fun weekend this weekend, kind of a belated celebration of our 5-year anniversary.
I didn't wish you a happy anniversary, and it's on my birthday. You tried to make it easy for me. I'm so sorry. Happy anniversary, Lauren and Nolan.
That's okay. Thank you. We went on a hike in the Aspens, and then we went axe throwing yesterday for the first time, which was really fun. I was actually really nervous about it. I don't know. I'm like me and sharp things don't necessarily mix well in my head.
Did you think you were gonna like instead of throwing it forward at the target, you were gonna throw it into your foot?
Yeah, or like throw it backwards or something. I don't know. I don't do great with motor planning new things, so I was a little scared. But nothing bad happened. It went great. Nolan won. No surprises there. He wins everything. He's a natural at almost everything. But I did manage to get a bullseye once, and I was super excited about it. Yeah. And today we're heading down to Sedona to do another hike, and yeah, it'll be a fun day.
Awesome. I'm glad you got out in the Aspens. I'm assuming it was very yellow.
Yes, it's very beautiful right now.
This is
the time of year.
Yeah, I don't think we have much more time. So
yeah, I think it's gonna go quick. It's getting cold.
Yep. I'm gonna get Duke out today so he can see some more yellow because he really cares about the autumn leaves.
Oh yeah, you're doing it for him, not for you.
Correct.
Yeah.
Well, I am. In fairness, I would probably just like stay home and like clean up the garage because right now Julia can't park in it.
Oh yeah.
Yeah, and just so everybody listening, I didn't take the garage and like you're the one that has to get out there. No, my truck doesn't fit at all. But she can't park in it because we're like moving the basement stuff, which is all our tools and stuff into the garage, but it's a mess right now. So
gotcha.
Anyway, yes. So we're gonna go hiking. That was a long story short.
Yes. So what are we gonna talk about today, Travis?
Well, a few weeks ago we had an episode about pregnancy, and in that we alluded to a potential episode where we looked at healthcare systems across the world. We stated that they're all bad. And today we're going to explain that statement a little and look into why they are bad. This episode really has been inspired by my experience working in the healthcare system, where very few practitioners seem to have any understanding of exercise and diet. So our basic conclusion of that episode that we are still not going to promote or produce is that our healthcare systems in the world don't promote health. They're really, the name is a misnomer. They should be called disease management systems. They're not even very good at that, but that's really what they try to be. A large part of this is because most of our healthcare professionals spend hundreds of hours studying pharmaceuticals and treatments that have marginal effects on health at best, while they report that they feel too ignorant to speak to their patients about physical activity. Don't take my word for it, though. We're about to go over the research.
So healthcare professionals have a key role in promoting physical activity, particularly among populations at greatest risk of poor health due to physical inactivity. A 2021 study looked at our understanding of healthcare professionals' knowledge, decision-making, and routine practice of physical activity promotion with older adults. A cross-sectional survey was conducted with practicing healthcare professionals in general practice, physical therapy, occupational therapy, and nursing in Ireland and Northern Ireland. Of 347 eligible responses, 70.3% of all respondents agreed that discussing physical activity is their job, but only 30% agreed that they have received suitable training to initiate conversations with patients about physical activity. Less than a third of respondents had a clear plan of how to initiate discussions about physical activity in routine practice with older adults. Assessment of physical activity was not routine, neither was signposting to physical activity supports.
Lauren, I'm already starting to get angry.
You just wait, Travis. You're gonna get even more angry.
It's so absurd. It basically just confirms that the education in Ireland is similarly ignorant to here, and that their healthcare professionals have no idea about exercise and diet, even at a very basic level, or they feel like they have no idea so much that they're not confident enough to tell somebody to go get on a treadmill or whatever. All right. So similarly, a 2020 systematic review found that healthcare professionals reported knowledge of physical activity and its promotion pathways were quite varied. And this could be an indication that more awareness and training may be required. Oh, yeah, there's a lot of indications that more awareness and training may be required. Despite the divergence in knowledge, there were optimistic views from healthcare professionals about the importance of promoting physical activity, their effectiveness, and confidence in promoting it. I don't know what that means. Like... like 70%. I mean, is this basically saying that 70% of them think that it's their job and think that they should do it,
and think
that they're going to learn it at some point? Is that basically what we're getting at?
Yeah, I think they think that it's valuable and important. I think that's what it's saying.
But they don't know how to do it.
But they don't know how to do it.
Do they just expect that one day they're going to learn it?
Maybe
that's kind of what I think they're saying.
They're going to take some continuing ed.
Yeah, that's kind of what I'm saying, or what I'm thinking that they're saying. Yeah, they're waiting for someday when they learn it. Someday just never comes unless you make it come. The majority of healthcare professionals viewed physical activity promotion to be part of their role. Again, despite this overwhelming agreement, some healthcare professionals in a qualitative study thought their role was limited, and the number of nurses viewing physical activity promotion as part of the role were less compared to other healthcare professionals across the included studies. That one doesn't surprise me. In nurses' defense, they're not. So physical therapists, we have autonomy in our jobs. I don't get told what to do. Mm-hmm. Some physicians try and tell me what to do, but if you tell me what to do and it doesn't say exercise, I'm not doing it, period. Mm-hmm. Nurses don't really have that ability to just say no, because they have to work under the license of a physician. So if they're working for said physician that says they should do all of this passive crap and they shouldn't talk about exercise with the patients, then they really probably shouldn't, because they'll get fired.
Right.
So that actually seems legit. So I did want to, just defend the nurses out there.
Credit where credit's due, I guess.
Yeah, exactly. When asked about whose role is best suited for promoting physical activity, healthcare professionals in a cross-sectional study ranked physical therapists highest. Yay! However, one study argued that physical therapists failed to promote physical activity because they viewed it outside of the role. Who are these people? I've worked with these people. I know who they are. It's incredibly frustrating. If you like that is our job. Like every study in physical therapy says to exercise. Like it's the number one thing. You could pretty much say that in every study in health, but specifically in physical therapy, like everything.
That's literally like what we went to school for.
Yeah, and literally everything else that physical therapists use, the research is pretty clear that it doesn't work for crap. So, anyway, rant over, Lauren. That's not true.
Not true.
The study listed possible reasons for this. Again, we're talking about how physical therapists view physical activity outside of their role. Yeah. The study listed possible reasons for this could be because physical activity promotion is not an integral component of most physical therapists practice. Again, what? And these specialists now practice with a wider scope, which perhaps leads to more divergence in their physical therapy activity or physical activity promotional roles. So I can see that argument because every healthcare professional association, like the APTA is ours, they are constantly trying to get more and more. One of the things that the APTA is currently trying to do is get us the ability to talk about nutrition more and get that in our scope of practice. Yeah, you didn't know that? Yeah. Well, you work with kids.
Yeah, it's not going to come up for me.
Yeah, your stuff's totally different. So that's one of the things they're trying, and I think that there's some value in that, like in basics, but like nutrition planning is one of the things that they're talking about. And no, like
Yikes.
We have dietitians for a reason. Let's actually utilize them in society because they actually go to school.
Right. I don't have any
diet.
education on that.
Correct. And what you have when you have a population, yeah, we literally have no education on that. Like I remember one diet conversation in PT school about sugar. You remember that?
Oh yeah, I remember that.
Yeah. Like anyway, so yeah, we have almost no education, if any. And what happens when you have low education in something is a lot of people become very biased to one thing. So those fad diets, most people would just be like, yeah, veganism's the best. And they just won't look at any research that goes outside of that. And that's a problem because not everybody wants to be a vegan, dude. Anyway, so that is a problem in healthcare. Is people always trying to do more and more and more.
Trying to make everybody a generalist when people are supposed to be specialists for a reason.
Yes. In summary, we're still in the same study. In summary, the general perceptions of healthcare professionals about key determinants of physical activity promotion are encouraging. I
beg to differ.
How do they keep coming up to these conclusions?
Just trying to put a positive spin so we don't just feel like we're drowning.
Current physical activity promotion practices could be made more efficient if fundamental obstacles such as limited consultation time, yes, underutilization of physical activity referral services, and the lack of physical activity knowledge and resources are addressed. Yeah, I think I probably said this on the podcast before. I truly think that personal trainers should be in physical or in the healthcare system. Yeah, the summary that they just said is it just doesn't make sense after the study. No one actually sees it as their role to educate the population, including physical therapists, and to educate the population and try and increase patients' activities levels. How did they come up with it? It's encouraging. Not even physical therapists, Lauren.
I don't feel encouraged, and I'm a pretty optimistic person, so.
Me too. I'm ridiculously optimistic, but I do get upset with stuff like this because it's like, it's just so crazy that we're in 2022 and we still don't value exercise in society, in healthcare at least.
Yeah, so another study from 2017 surveyed 166 general practitioners, 65 general practitioner registrars, and 71 practice nurses to determine their knowledge of the benefits of physical activity in preventing and treating ill health. 55% of responders underestimated UK recommended activity guidance. Responders considered activity promotion as part of their professional role, but this was discussed about 1/3 as often as other health promotion behaviors such as weight or smoking. Barriers were reported such as lack of time, which was 91.2%, and resources, 36.8%. There was a poor recognition of simple tools to assess the level of physical activity and low levels of onward signposting or recommendations.
So not even promoting it. Well, but and part of the resources that they reported, the 36% reporting that they didn't have the resources is probably meaning that they don't feel confident. And if you put a sign up that talks about how good activity is, do you know what people are going to do?
Ask you about it.
They're going to ask you about it. So you don't put the sign up because you don't want to be asked about it because you're
not confident,
too busy, too lazy to learn about it. And therefore you just ignore it. Why is this so important? So in early February 2021, a study published in the British Journal of Sports Medicine became the first to make the case for exercise's protective benefits based on directly measured physical activity data for COVID-19. They were not the first to make this case. They were first to make this case in a study. And if you think about that, February 2021, that was less than a year after the pandemic really started in the US at least. The Small Steps, Strong Shield study proved that any form of regular physical activity, even less than 2.5 hours per week, can protect against severe COVID-19 outcomes. Well, the level of exercise required to improve COVID-19 resilience falls far below the World Health Organization's recommended weekly minimum. That is not to say you should forego that run on the one day you don't feel like it. This is because the best outcomes in terms of preventing hospitalization, ICU admission, ventilation, and death are seen in people who do meet the WHO recommended guideline of more than 150 minutes of exercise a week. 150 minutes of exercise a week. Wow, Duke. I'm sorry. My dog is literally biting me to try and get my attention. So I'm a little bit distracted while recording this. I'm doing my best.
You're doing great.
So 150 minutes of exercise a week. What is that, like 23 minutes a day?
Sounds about right. I don't know. You're the math person, not me.
It's
not a lot.
It's close to 23 minutes a day if it's not right around, or if it's not exactly that. That's the recommended guideline that gives you the most protection as far as what they find in studies. You can do 23 minutes a day. You waste way more than 23 minutes a day looking at Facebook, Instagram, TikTok, whatever. You can fit this into your day. The study found that compared to those with low levels of activity, high engagement in physical activity was associated with a 34% lower risk of hospital admission, 41% lower risk of ICU admission, 45% lower risk of requiring ventilation, and 42% lower risk of death. I've also seen newer studies that have shown that it's 40% less risk of just getting the virus in the first place, which really makes those risks way lower because it compounds. Mm-hmm. Even those patients engaged in moderate activity, which would be less than the 150, had a 13% lower risk of hospital admission, 20% lower risk of ICU admission, 27% lower risk of ventilation, and 21% lower risk of death compared with the low activity group. Lauren, we knew this. We knew this from studies with every other illness known to man. Exercise is extremely protective, as we've gone over in previous episodes. In other words, we should not have needed these studies relating directly to COVID. However, we have a healthcare system filled with practitioners who are ignorant to the benefits of exercise or do not know how to talk about exercise. So they allowed the promotion of things that we knew wouldn't do anything instead of pushing back and promoting exercise. And we're still not promoting exercise, Lauren. We have dozens of these studies now directly relating to COVID-19. I've not seen a single commercial. That's a lie. El Salvador had a commercial for they had a great commercial. It's like mindfulness, exercise, everything. Drinking water. They had a really great commercial. Not here. Not in Europe. Not in America. I don't understand.
I don't know what to tell you either.
So unrelated news, Lauren. Do healthcare workers exercise themselves? And what's their health like?
Well, according to the results of one study, healthcare workers, for the most part, had low levels of physical activity. According to the participants, the main reasons preventing them from working out were the lack of free time, the working hours, and also just negligence. Also, they reported that working in a hospital is a physically taxing job, and when combined with demanding household chores, it can reduce your willingness to engage in other physical activities, which was also supported by some other studies.
So they basically have the same exact excuses as every single other person that's not exercising. Yeah.
Any other person.
Because they're working a job and they have kids and they have a life and yeah.
Any other person. Yep.
So they're the same as you.
Yep.
Listen.
A new study published in the American Journal of Preventive Medicine concludes that healthcare workers have higher obesity rates than almost any other industry's workers. The obesity rates were not evenly distributed throughout the industry, though. Those in health services category had much higher obesity rates than those in health diagnosing jobs, which pay much better.
And I've also seen studies where they look at that pay because obesity is related to socioeconomic status, and they look at the pay, and even when they compare physicians who are high paid to other high paid professionals, lawyers and whatever, they still find higher obesity rates than the general population at that socioeconomic status. So it's still not good. Anyway, Lauren, in conclusion, take this general ignorance by healthcare providers, then add the fact that the average physician gets 7 minutes with a patient, then add that we have a government that clearly cares more about their friends at Pfizer than they do anyone that's actually listening to this podcast, and you get the desperately unhealthy population that we have today. I'm not saying that exercise is the single best treatment for each and every condition we may be diagnosed with, but I am saying that it is the single best treatment for an unhealthy society. And it is the most accessible and effective prevention of disease that we are aware of. Exercise also aids the treatment of virtually every condition we know of. In other words, while Jane may need meds to fight off whatever ails her, exercise will aid those meds to help her recover faster. Your body just works a lot better.
Mm-hmm.
This was a very happy episode, Lauren.
It's a little frustrating episode, but
didn't frustrate me at all. Could you tell?
Oh, not at all. Didn't see like the red glowing in your face while you were talking.
It's so absurd. Anyway, well, great job today, Lauren.
You too, Travis. I guess the challenge for this week would be to exercise.
Oh yeah, we didn't even make a challenge. Yes, exercise.
And talk about exercise to your friends.
Yeah. You can be a better healthcare provider than healthcare providers if you just, talk about exercise to people. All right.
Well, this was funnish.
This was funnish. Thanks everybody for listening. I hope we didn't depress you too much, and we'll see you next time.
See you next time. Bye.
Bye.
Thank you for taking the time out of your busy day to listen to this episode of the Health and Happiness Podcast. We hope you enjoyed the episode and are getting benefits from our content.
If your life is improving in part due to the information in this podcast, we would greatly appreciate you sharing the episode with your family and friends on social media and leaving us a review so we can continue to reach more people and improve the health and happiness of the community at large.
Thanks again, and we will see you next week for another episode of the Health and Happiness Podcast.